Good morning. We are OHSU nursing students that are running through a full head-to-toe assessment. In this demonstration, I am using our head-to-toe assessment form. This is to provide consistency as well as just to show current sophomores a flow of how this assessment is supposed to go. Please refer back to your assessment forms and enjoy the show.
Come in.
Hello, my name is Danny. I'm closing the curtain behind me. I'm a nursing student today. I'm going to be doing your full head-to-toe assessment. Looking around the room, I see that all of my cords nice and wrapped. Nothing is around the bed. We have our bed rails up. There's no additional people in the room with us. And I'm just verbalizing these to make sure you are safe and I am safe. Can you give me your full name and date of birth?
Sarah Lane, 5/22/2001.
Wonderful. So looking at my patient, she is dressed appropriately for the weather. I'm seeing nothing that's jumping out at me. My patient is talking to me in full sentences. Her airway is open. She's breathing adequately. I see no hemorrhaging, no concerns for her circulation. Making sure that I'm washing my hands. Okay. Can you tell me where you are?
The hospital.
Wonderful. Can you tell me what season it is?
Fall.
And can you tell me why you are here?
For a general assessment.
Okay. And so while looking at my patient, her face is nice and symmetrical. Can you give me a nice big smile? She's able to follow commands wonderfully. Is there any concerns that I can take care of at this moment?
No.
Okay. So we're going to jump right into it. I'm going to go ahead and clean all of my equipment. Have you ever broken your nose before?
No.
Okay. And then any false teeth?
Nope.
Beautiful. Okay, so I'm going to start off by looking at your eyes.
Okay.
So this is going to shine a real bright light in your eyes. I'm going to have you look at my face and I'm going to have you try to count all the freckles. Okay? Wonderful. Okay, so while I'm looking at your head, I'm going to look at your ears. I'm going to touch your hair. Okay? So no additional drainage, no wounds. Looking in this ear, no additional drainage, no wounds. Okay, I'm going to have you stare at the top of my pen, and then I want you to look off at that lovely poster out there. Okay? So when I count to 3, we'll change our view. So pen to poster.
Okay.
Ready? 1, 2, 3. Okay, so pupils are equal round, reactive to light, and accommodating. Her ears are nice and clean. I'm going to go ahead and look in your nose. You can look up for me. I'll try not to blind you. I see no additional drainage, no wounds. The mucous membranes are moist. Can you open your mouth and say ah for me? And stick out your tongue. All right. Throat shows no redness, no swelling, no broken teeth. Nothing of concern. Okay, so now we're going to go ahead and assess the lungs. Can I have you move to the edge of the bed for me? Okay, any history of asthma?
Yes.
Okay, and you're talking to your doctor about that?
Yes.
Beautiful. All right, so looking at my patient, as she's breathing normally, normal chest rise and or regular chest rise and fall bilaterally. So this is going to be a lot of breathing. There are 12 points in the front and on the sides, and then 14 on the back. If at any point you need a break, please let me know, okay? Okay, so with each move of my stethoscope, I'm going to have you take a nice, big, deep breath for me. Can you go ahead and lift the girls for me? Thank you. last one on the front. Okay, still doing okay?
Mm-hmm.
All right, I'm gonna go around to your back and we're gonna do it again.
Okay.
Okay, when you're ready. Okay, you did wonderful. Lung sounds were clear and equal in all 5 lobes. Are you feeling dizzy at all?
No.
Okay, I'm gonna have you go ahead and sit back in bed again. Okay, so now I'm gonna go ahead and do a cardio assessment. So I'm gonna listen in a few different places in your heart. I'm gonna listen to them twice, so once with my diaphragm and then once with my bell. And the bottom portion of your heart, I'm gonna listen for a full minute. So we're gonna hang out together for a little bit.
Okay.
Do you have a history of any heart conditions?
No.
Okay. All right. In the second intercostal space on your right side, I'm gonna listen to your aortic valve. Second intercostal space, left side pulmonic valve. Third intercostal space, Erb's point. Fourth intercostal space, tricuspid valve. All right, I can kind of lift the girl. Thank you. Fifth intercostal space, midclavicular mitral valve. We're gonna listen for a full minute. Okay, wonderful. Are you good if I do that all again?
Yes.
Okay, so now we're switching to the bell. This is going to allow me to listen to lower tones. All right. Aortic, pulmonic, tricuspid, or I'm sorry, Erb's point, tricuspid, thank you, and mitral. All right. I heard normal S1 and S2 sounds in all valves and no noted arrhythmias. Okay, so I'm gonna keep listening in a few different areas. So I'm gonna listen to a carotid bruit on both sides of your neck. And then I'm also going ahead and listen, it's just underneath your sternum and it's an abdominal bruit. Is that okay?
Mm-hmm.
Okay. And I'm so sorry, my hands are cold. Carotid bruit noted, and then I'm going to feel for the bottom of your sternum. Here we go. All right, and no abdominal bruit noted. Okay, so continuing to move down the body, I'm going to be feeling around on your stomach. Have you ever had an abdominal surgery?
No.
Have you pooped today?
No.
Okay. I'm gonna lay you down flat. Is there any reason I can't do that? Okay, are you comfortable?
Mm-hmm.
Can you point to your belly button for me? Beautiful. So looking at the stomach, I'm seeing no discoloration, no distension, no skin wounds. Okay, so I'm gonna start off by listening in all areas of your abdomen, and then I will be tapping, it's called percussing, and then feeling around. Please let me know if you have any discomfort. Okay. All right, starting in the lower right quadrant. I heard one bell tone every 3 to 5 seconds, which is normal active. Go ahead and percuss. Okay. All right, any pain?
No.
Okay. I felt no lumps or bumps, and I had no abnormal tones with percussion. Let me know when you're comfortable. Okay. Okay. All right. I'm gonna have you give my hands a nice big squeeze. Wonderful strength bilaterally. I'm gonna check capillary refill on the right, and then on the left, less than 3 seconds. I'm gonna go ahead and feel for your radial pulse. Pulses are strong bilaterally. And then we're gonna play a little game. Can you go ahead and close your eyes for me? Which finger am I touching?
Pinky.
And which one?
Pointer.
Beautiful. Okay. Coming down to your feet, I'm gonna do the same thing. Are you ticklish?
No.
Okay. So I'm going to feel for the posterior tibialis pulse. Pulses are strong bilaterally. Can you go ahead and push down on my hands like a gas pedal and up towards your nose? Strength is equal bilaterally. So I'm going to check cap refill on the right, and then on the left, less than 3 seconds. All right, how many times do I tap?
2. 1.
Wonderful. So sensation is also equal bilaterally. I'm going to go ahead and wash my hands. Okay. And then I'm going to be pushing in a couple of spots on your shin. This is checking for edema or swelling. I have no evidence of pitting edema. All right. Is it okay if I check your vitals today?
Yes.
Okay. Do you have a preference on which arm I get to squeeze?
Use this one.
Okay. And do you know what your normal blood pressure is?
120/80.
120/80. Okay. All right, and then on that hand, pick a finger, any finger. Okay, so today I got 124/72, which is within the normal adult range of 90/60 to 120/80. SpO2 is at 97%, which is within the normal range of 95 to 100%. I'm gonna go ahead and take your temperature. This is just gonna go on your temple. 97.8, which was within the normal range of 97.2 to 99.9 Fahrenheit. All right. I'm going to go ahead and check your pulse. Okay, today we have a pulse of 72, which is within the normal range of 60 to 100. And your respirations, which I also took, were at 16, which is within the normal range of 12 to 20 breaths a minute. Okay. So last couple of questions I have for you. Do you have any pain today?
Yes.
Where do you have pain?
Where they poked me for my blood draw.
Okay. So looking at it, I see no signs of infection. When did this start?
This morning.
Okay. Is there anything that makes it better or worse?
Not using it.
Okay. Does it radiate anywhere?
No.
On a scale of 0 to 10, 10 were being mauled by a bear. How bad's that hurt today?
3.
Okay. And what is our goal today?
1.
All right. I'll see what I can do about that. So, I'm going to leave the room. I'm going to go ahead and chit chat with the doc, and then he should be in shortly to finish up the rest of your paperwork. I'm making sure your bed is nice and low for safety reasons. Are you comfortable?
Yes.
Okay. Is there anything else I can get you before I leave?
No.
Sounds great. If you need to get a hold of me, big black button. This is your call light. I'm gonna make sure that I'm cleaning all of my equipment before I leave. Any fun plans with the rest of your day?
No.
No?
Just go home and relax.
That sounds like a great plan. All right. All right, and wash my hands. Okay, I'll be back soon.
Okay.
And close the door.